Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the guys behind the counter, Mark, Ben, and Mike, tell you about today's specials. Welcome to the deli. So today's episode is a special one because we are on the road.
On the road again.
We have the Health Deli food truck fueled up, and we are in beautiful Canadian Lakes, Michigan at the Canadian Lakes Pharmacy. This pharmacy is owned and operated by Brent Beamer, who's a Ferris State Pharmacy alum.
Go Bulldogs.
Go Dogs. And
D2 national football champions back-to-back.
Yes. And he's a young pharmacist that had that entrepreneurial spirit and started a pharmacy here. And it's a beautiful little pharmacy. It's in a plaza. There's little restaurants and other little shops here. It's just a wonderful location. So
You know, the funny thing is Canadian Lakes is nowhere near Canada.
You're right. I've never thought about that. I've lived in this area most of my life, and I've never really thought about where the name came from. But yeah, you're right. We're a long ways from Canada.
But it's a beautiful group of lakes and stuff here.
It is nice. Probably came from the fact that maybe it looks like lakes in Canada. I don't know. Maybe.
No, probably not.
I don't know. Lakes look like lakes to me. But
yeah.
I don't know. It's really nice.
We're off to a rough start on this one already.
And Brent has done a great job with this pharmacy. So I invite any of our listeners, if you're looking for a day trip, come up here to Canadian Lakes, visit, stop in, see Brent at the pharmacy.
Say hi. Tell them the Health Deli sent them.
That's right. Plug the Health Deli. So it's Dr. Mike Klepser and myself, Mark Young, taking the reins.
How you doing today, Mort?
I'm doing all right. For some reason, he insists on not calling me by my name, but that's okay. I'm just going to roll with it.
I don't want to look into your eyes either.
I don't want to encourage any of his bad behavior, so I'm just going to keep rolling. And then Dr. Pountifract has the day off today. I don't know what he's doing. Probably taking a nap somewhere.
He's probably one of those mosh pit fests or whatever he does.
Some of his crazy
punk pop stuff.
Whatever he likes, yeah.
Either that or maybe meal planning for the week. One or the other.
Probably that's what we both should be doing, but we're not. Is he probably?
See, if I meal plan, I eat it all right then, because it usually looks so good, and then I've got nothing left to eat for the week.
Yeah, I'm not a meal planner. I did start exercising recently. That's a feather in my cap, but I'm not a meal planner. Andrew, behind the camera today, and behind the microphone.
Well, he's actually on camera too. Wave to yourself.
He is all over. Anything new you're working on back there?
Yeah, actually, so we're trying to incorporate video whenever we go out with the truck, but also we're planning to do a live stream.
Ooh, a live stream.
Yeah,
Make sure you get that bleep button ready.
We'll have to share that.
You don't know what's going to be. Is there going to be
We'll go on a time delay?
A little delay?
Yeah.
Probably good with us.
I like it.
And who do you got with you today?
Yeah, we have Forrest over there working the audio mixer. So that's great. Thanks, Forrest.
Really? Because work is really, I would say, stretching it. He's more just like sitting there and just shaking his head a lot.
Yeah.
There you go. I like his that. 2 thumbs up, positive attitude.
And a shake. Speaking of work, and I use that term very loosely, is there anything you've been working on, like future episodes or anything you got going?
You know, I've been thinking about a lot of things, and every time I say that I'm going to do something, there's something new that comes up in the world, and it usually grabs my attention. I think one of the things that I would like to do before season 2 ends is do another episode of questions from, we did the one with kids. I want to do it with college students. I want to go out and about the greater Ferris State University area and see what's on the minds of the youngsters of today.
Yeah, maybe we could go on location somewhere at a public spot on campus.
Yeah.
Yeah, it'd be fun.
Yeah, we invite the president back to come with us.
That would be great. He was a great guest. I've been working on a couple things, a seasonal affective disorder topic, another on location topic where we can talk about seasonal affective disorder. I also am just starting this idea of having a bad habits epised.
You are a bad habit.
They used to call me the bad habit.
Did they?
Not really.
That would be a great nickname.
No, that was a nickname for one of our teachers in Catholic school.
Mike, Ben, and the bad habit.
The bad habit.
Or that could be like a nun, and it just was like a bad hat.
That's exactly what the bad habit. She was a great person, though. So let's get into the topic of the day. So this episode's topic is continuing our Know Your Numbers theme. And
Also known as the What's Wrong with Mike series.
The What's Wrong with Mike series. So today's episode is What's Wrong with Mike? Cholesterol, also known as lipids. So we talk about cholesterol and we talk about lipids, and really we use that term interchangeably. Do you know what cholesterol actually is defined as?
I do not.
Yeah, so I actually had to look this up. I kind of remembered it from undergrad biochemistry, but cholesterol is just a term that defines a 27 carbon compound.
Not 26, not
26,
28.
Not 28. It has to have 27 carbons.
Who counts them all?
A special like chemical structure. I usually do that.
Okay.
I'm usually the one that counts those.
Perfect. You have
but
to take your shoes off and get another friend to come over to help you out count that high.
I do,
Yeah.
But cholesterol, it sounds like, oh, cholesterol is this terrible thing, but actually cholesterol is in every cell in our body. So our body has to use cholesterol.
It's a building block, really. I mean, it's a necessity for a lot of things.
Yes. And when we talk about cholesterol, like a cholesterol test, we're actually not even testing the amount of cholesterol in our blood. We're testing the amount of what we call lipoprotein, which is a complex of protein and cholesterol together. And it's basically like a little shuttle, like a little train, if you will, that's carrying the cholesterol to where it needs to be. So we use this term cholesterol incorrectly, probably way more often than we use it correctly.
Huh, interesting.
So when we're talking about cholesterol today, I'm just going to use it incorrectly because so many other people do. But we're probably actually talking about lipoprotein. And then you probably have heard this before where we have good cholesterol and we have bad cholesterol, right?
Yeah.
So the difference is really in what the functionality of cholesterol is. And there's two functions. So in this lipoprotein, we have LDL, which is called low density lipoprotein.
Oh, there's that lipoprotein that you were saying. It's
Exactly.
not low density cholesterol.
No, it's lipoprotein. Okay. But what that does is it shuttles cholesterol out to our tissues.
It's like the soccer mom of the
Kind
cholesterol. It seems like they would be good, though.
Yeah, well, it is good. It's necessary, so you have to have it because without it,
the kids won't go to soccer if mom doesn't shuttle to soccer practice.
Exactly. But the problem is if you have too much LDL, you shuttle out too much cholesterol, and then it starts to deposit on our arteries, in our vasculature. And
again,
starts
like
to
soccer
problems.
moms, as a former youth soccer coach, the moms drop off the kids and then deposit them on the field.
If they can't find where the kid's supposed to be dropped off at their home, they're just dropping them off on the street. And eventually the street gets clogged up with all these soccer players.
This would be great. We've just revolutionized discussions of cholesterol.
Yeah. So our streets are lined, if you have too many soccer moms, without being able to find the homes for these kids, the street is lined with cholesterol, which creates hardening of the arteries and all sorts of other bad things. That would be bad cholesterol. So good cholesterol, though, is known as HDL, high-density lipoprotein, and its job is not to carry out cholesterol. It's to bring cholesterol back to the liver. So if you have a lot of HDL, it cleans up. It's like the soccer dad maybe that's going along the street picking up these kids and getting them where they're supposed to be.
Let's call that like the street sweeper.
Yeah, there you go.
Cleaning up the mess. Yeah.
Yeah. So it's picking up all these kids. And
we could get into a lot of trouble comparing soccer dads and soccer moms.
I know. That's I wanted to steer. We love soccer moms and soccer dads.
If you have any feedback, please email Mark
Young.
So ideally, what we want is a low number of our LDL. So we want a lower concentration of LDL that's carrying that out there. And we want a lot of HDL that's bringing it back to the liver. So the liver is basically like this little chemical factory, and it brings in the HDL, and then it will convert that cholesterol, reattach it to the LDL, and send it back out. We also have this thing called VLDL, very low density lipoprotein, which is also, as you can imagine, bad, even worse than LDL.
But it's very low.
It's very low, which means it can actually carry more cholesterol out and deposit it.
Really?
Yeah.
Huh. I did not know that.
Triglycerides are another component of the cholesterol test that aren't even cholesterols at all.
So why are we even talking about them? Then that just sounds stupid. Let's
Well,
focus this.
It has a similar effect on the body that the cholesterol does, in the fact that triglycerides, when you take in a meal, you have all these calories. If you take in a meal that has more calories than what you can use right then, our body breaks those calories down, converts them into triglycerides, and then triglycerides circulate throughout our blood. And then what happens is, if we don't need them, then they start to deposit as fat. And if we have too many, they'll start to deposit on our vasculature and cause more of those hardened arteries like we're worried about. Does that kind of make sense?
Yep.
Okay, so all of us need triglycerides as well. So when we do a cholesterol test, if you ate before the test, it's very normal to have high level or higher levels of circulating triglycerides. So that's why it's very important, before you have a cholesterol blood test, to fast. So we're going to do a test a little bit. Did you have breakfast today, Mike?
Yes.
So he did have breakfast. So those triglycerides will be what we call falsely elevated. So I expect a higher result because you ate some breakfast this morning. So you want to fast for 12 hours before a cholesterol test. Unfortunately, Mike didn't follow his directions, so we're not going to be able to.
I'm a bad patient.
Right now, the other components of the test, the VLDL, or excuse me, the HDL, the LDL, the VLDL.
So
would still
this
be fine.
is still blowing my mind. We're talk about cholesterol all the time, but we're not even measuring or looking at cholesterol.
Right.
It's like, God darn medicine. They're just trying to pull the wool over all of our eyes.
Yep. Yeah, I agree. We misuse that term more often than we use it correctly. So,
So is all this? I'm assuming you're going to get into what's good and what's bad.
yes. So what's good is eating a nice, healthy diet. Okay.
Why?
Well,
I like donuts and bacon, egg, and cheese biscuits. Is that healthy?
no, that is not healthy.
So I did a search of the literature a few years ago, and I was unable to find any papers that specifically state donuts are bad.
There's so many comments I can make about that.
I like data that supports my unhealthy lifestyles.
You know what? I might just take that and run with it. I think I'm just going to order a dozen donuts right now. There's nothing that specifically says it's bad for us, so
right.
it must be good.
Everything that you're talking about is inference.
Yeah.
You don't have hard data. You're just making stuff up.
I am just making things up. But so a lot of people think, oh, cholesterol comes from eating too much. So cholesterol is in a lot of the things we eat, especially red meat. Anything that any kind of meat has a lot of meats have a lot of cholesterol in it. Our body, actually, our liver produces all of the cholesterol we need. So we don't need to eat any cholesterol at all, even though it's in a lot of things. Okay.
So why is it in a lot of things?
Well, it's because it's in every living cell.
Okay.
In an animal.
So it's not that you look for, high cholesterol things. It's just kind of there.
It is just there. Now, some meats are higher in cholesterol than others, and I don't want to go all the way down that.
I'm assuming bacon is low.
I'm assuming bacon is not low.
Dang it.
I'm assuming that has a lot of cholesterol. Eggs have a lot of cholesterol.
I'm talking American bacon, not Canadian bacon.
Right.
It's still bad?
I think so.
Dang it.
Everything in Canada should be a little bit healthier, I would think, though. And we're in Canadian lakes, so I don't know how that all plays in. Maybe they have Canadian bacon here.
I hope
don't
not.
know. We'll have to check at the local restaurant.
No, I want American bacon.
So the reason I brought that up, though, is that we're making cholesterol in that some people, even with a healthy diet, so even if you did everything you're supposed to do, there are folks whose bodies just simply produce too much of that lipoprotein. So
is there a name for that? Is that like familial hypercholesterolemia?
Yes, it is. Exactly. So genetics, again, play a big role.
See, and that's what I like as well. If something bad happens to me, I want to be able to trace it back to my parents.
Just blame them for everything.
Yep. Hairline, high blood pressure, cholesterol, ornery attitude.
Yep. So I have very low HDL, and I blame it on my dad. He has the same thing. So I have low levels of the good cholesterol. Thank goodness I also have very low levels of bad cholesterol, so I'm hoping that kind of cancels out.
You got that from your mom?
Probably. She just has very low cholesterol. She actually has high, good cholesterol. She's like got the perfect cholesterol panel.
Yeah, my mom went to the doctor and got her cholesterol tested, and the doctor said, you should go home and eat some donuts.
Really?
Really?
Wow, I wish my doc would tell me that.
I know. My doc says a lot of stuff that I just ignore.
Yep. So we're going to talk actually about gender differences, age differences, and how those impact cholesterol levels.
Old white males are good.
Well, old is the key in that statement. We'll talk about that when we get there. Would you like to get a lipid test today?
I actually would. So I'm going to tell you why.
Okay.
Years and years ago, when I was a young buck, maybe about the age of Forrest over there, I had my blood drawn for serum for a study in the lab. And when the tech drew my blood and spun it down, they go, your blood, spun out, and you got a lot of stuff here that looks like jelly. They're like, this isn't supposed to be there. I think your triglycerides are high. So I went and got my my cholesterol checked and stuff like that. My LDL is sky high. My triglycerides were 600 or something ridiculous like that. And so even since my early 20s, I've known that I've had high cholesterol, and I've been treated, that I know that we'll talk about, for years and years. So I'm always interested, to see what my cholesterol looks like.
So you must take after your dad.
Yeah. Did you say that because of the hair? I'm going to tell my dad that you make fun of his hairline.
I would never make fun of someone's hairline. I have nothing to talk about. So we have a small space here, and I'm going to concentrate on doing this correctly.
Can you do this finger?
I can do, yes.
Okay.
Just for the listeners out there, he's very prominently extending one finger.
It's the longest one. It's
right
easiest to
in the
get to.
middle. It really is.
Yeah.
There is a video of this episode.
Yeah. So, Andrew, would you do the play-by-play? Because I'm going to have to be off mic here for a little bit.
Yeah, anything Mark says, I'll repeat it.
First, he's cleaning my finger.
You're not Andrew, Mike.
Yeah.
I was telling you so you
can't
could
follow
repeat it.
directions.
But we can hear you.
He was quiet. I mean, so he's
That's
like,
fair.
repeat
That's
what I
fair.
say, and he
Yes.
says nothing.
Is that an alcohol cleaning
Crickets.
pad
Crickets.
or some other type of? Okay, good.
And now I'm very intentionally being slow right now because I don't want that alcohol to contaminate our sample. So we want to let that dry. We don't want that alcohol to be.
So, and again, going back to the hand sanitizer or hand washing episode, the alcohol has to dry in order for it to kill the bacteria.
Not sterile
So
till it dries.
that's important.
Now, I will say this test only requires a small finger prick of blood. So it's not, you don't have to do a venipuncture, what we call, where you actually get a large amount of blood. Although a lot of times when you go to a lab, they have different equipment. So there are times when it requires an actual venipuncture.
Okay. You ready? All right, we're going to poke Mike. Mike is crying.
Did you use a blade? What are you doing now?
Are we getting the blood out? Oh, yes. It looks like a little tube. Is it made of glass or plastic?
That one looks like glass.
Okay. There's some other colors on this tube. It's very interesting.
You're not much of a bleeder, Mike.
We're trying to get Mike to bleed. I guess we'll have to do an episode about bleeding, blood thinners. Could we do that?
We can do
I
that.
heard that garlic has a lot of blood thinning properties, so much so that doctors recommend that you don't eat garlic before surgery. Is that true?
I don't know about that.
That's just so the surgeons don't have to smell your breath.
Oh, okay. All right, how's it going? Are we getting blood?
We are.
Okay.
This makes for great video. Doing it below the table.
Yeah, we can't see a thing right now. So if you do choose to watch the video, it's no different. In fact, if you're listening on any of the podcast players, I recommend you switch to at least 2 or 3 times speed. Okay, we are almost done.
Show him the tube, dude.
Quite a bit of blood. Good. Enough to do the test. All right. And if you're not watching the video, Mark has this nice machine with a printer. Going to give us readings from the test. Maybe we'll hear the machine. Although there are a lot of other machines in this pharmacy making noise as well today.
I'm just sitting here bleeding. I'm bleeding.
Do we have a
Hello,
Band-Aid for
I'm
Mike?
bleeding all over the place. It's my
Okay.
blood
Looks like we're gonna.
running all over the place. It's on
We're
your
not gonna
shoes.
clean it up. We're just gonna put the Band-Aid straight on.
Feeling faint now.
Mike is woozy. All right.
Okay, now to be honest with you,
Covered.
that really didn't hurt. You know, the prick or the drawing of the blood. So,
What'd you call me?
Maury.
Okay. No, it isn't. It isn't too bad. This was a test that requires a capillary tube full of blood, which is a little bit more than just like a glucose test if you've ever had one of those. So it's a little bit more in depth.
All right. How long does this take to run?
This is going to take a few minutes, so we can kind of move on. And when we get some results, I'll keep my eye on the machine here and
So
see what happens.
With this, are you going to talk about how often people should get tested for their cholesterol, or who should get tested?
Yeah, and it depends on their age. So if you're a younger adult, so younger than 45,
That's not me.
that is me. So younger than 45 every 5 years. We used to say not even test it till after 45. This was years ago, but then we realized we really wanted a baseline before. So we want every 5 years before 45, after, when you're an adult. And then after 45 years, so 45 to 65, every 1 to 2 years.
That's me.
Yep. After 65, we do not routinely test.
Is that just God bless you, go on living your life? You got this far?
No, it's actually because you're between the ages of 45 and 65 is like our prime time to start producing more of that lipoprotein. So that is just generally speaking when we see a rise in cholesterol. Now it can of course happen before that, it can happen after that, but that is when we see our peak rise in cholesterol.
So over 65, people just inherently produce less?
Exactly. What we see is a plateau.
Okay.
It's not that we don't treat high cholesterol, but generally, if you've had high cholesterol until before age 65, you're just going to have it after age 65. So whatever treatment you're on, we generally continue that.
Okay.
I will say that this is also a little bit like hypertension, one of those disease states that are much more associated with men. But that's not exactly true. That is a stereotype that is not true. So earlier, so before, in that 45 to kind of menopause age, it is more associated with men. So men have a higher incidence of hypercholesterolemia or high cholesterol in those years. But postmenopausal women actually have a very drastic increase in levels of lipoprotein after menopause. So it's very important that age group of females.
And during menopause, is that when women start to produce less estrogen?
Exactly.
And so they lose kind of that beneficial effect of estrogen.
Right. And we used to use estrogen almost in all postmenopausal females because we thought it had these health benefits of cholesterol, which it does, but
Is that so they found out that some of those estrogens were collected from horse urine?
That is actually true. But we found that there's some health disadvantages to that as well. So now we do not routinely recommend
Because horse urine estrogen's probably not
the best. Yeah.
Okay.
Yeah. All right. So what kind of numbers we're looking for? I'm just going to give you these numbers. We haven't talked about this, but the first number most people talk about is total cholesterol. And total cholesterol really doesn't tell the whole story because it is a number that's arrived at using the good cholesterol, the bad cholesterol, and triglycerides. So
it's just everything.
it is everything. It gives us like an idea, like we should maybe look at this guy a little bit closer. But it doesn't tell the whole story.
I don't want to look at you closer.
I don't want to look at you, period. But our total cholesterol, a healthy level would be 125 to 200. So you're looking for under 200 total cholesterol. That's what we're looking for today. Your non-HDL or your LDL, excuse me, should be less than 100. And then HDL 40 or more. Now that's for men. So we're talking about you. Women, same, everything is the same except the LDL. So the good cholesterol, you actually want that even higher in women. About 50.
The HDL, right?
The good cholesterol.
Okay, yeah.
The HDL, a little bit higher, up
Okay.
to 50 in women. And then a normal triglyceride level would be under 150. 50.
And so you mentioned that triglycerides are influenced by eating, and stuff like that. Are your, HDL or LDL affected by what I eat?
So long term, yes. So long term diet control, yes. Short term, like if you just had a cheeseburger right before the test, it may affect the test.
It was a bacon, egg, and cheese biscuit.
There you go, bacon, egg, and cheese biscuit right before the test. It may affect it just a little bit, but only a few percentage.
Okay.
So very, very small. All right, so we have some results. I'm going to jot these down real quick.
Uh-oh. He's jotting them down. I'm doing the play-by-play now. He's grimacing. He's calling 911. Here comes the ambulance. Oh, wait a minute. That wasn't 911. That was my mother. He's calling my mother and yelling at her for feeding me all those donuts.
All right, so I have results.
Drum roll.
Are you ready?
I'm ready.
Okay. So total cholesterol, which again, doesn't tell the story. What we're looking for is 125 to 200. Your total cholesterol. I feel like this is like an episode of, what's that talk show where they're finding paternity tests all the time?
Maury.
Is that Maury? Yeah. I feel like this is an episode of Maury.
All right, Maury, give it to me.
Let's see if you're the father. Total cholesterol, 189.
Woo!
Under 200.
Does that mean I'm normal?
No. It means your circulating level of cholesterol is normal, but not.
Gotcha.
And then LDL. Okay, so LDL is bad cholesterol. We're looking for less than 100.
Oh, I know this is not less than 100.
87.
You're kidding.
87.
What?
Yeah. So that is good. That's considered
It's
healthy.
about the same as my age. That's cool.
Yeah, it's similar.
Easy to remember.
Yeah. Good cholesterol. So HDL.
Oh, this has got to be perfect.
We're looking
I'm
40
good.
or more.
Yeah.
40 or more is what we're after. 46.
I'm golden.
Yeah. Well, I wouldn't say that.
So what I will say.
Last one.
Uh-oh.
Triglycerides.
Oh.
You were worried about triglycerides.
Well,
And I will say this one has to have an asterisk because he was not fasting. So we're looking for less than 150.
okay.
282.
282 ain't bad for me.
Non-fasting, we really can't use that.
Because I had mentioned to you that I had labs drawn a few months ago, and my doctor was a little, didn't like them, so he bumped my cholesterol medication up.
Yeah.
So do you have those? I think I gave them to you before. Did you write those down, or you forget about them?
I don't know. Yeah. 220. So you're old. So you had recently had an increase in your medication, your statin that treats your high cholesterol. You had a 221 total cholesterol. So you went from 221 to 189.
Okay, came down.
Your HDL went from 43 to 46, an increase. That's your good cholesterol. So
That's because that goes up with exercise too.
It does.
So I haven't done that.
Well, 43, 46, a little bit. And then your LDL, 138 previously, down to 87.
Wow.
That's a big decrease. Triglycerides, like I said, you were at 221 fasting. You're at 282 non-fasting. We really can't say anything.
Okay. So, but everything else, it looks like that increase in my medication.
Huge difference.
Wow.
Yeah, that is more than I expected.
Wow. I'll have to call him and say thank you.
So now, because we have your blood pressure from the previous episode, and we have these cholesterol results, we can calculate something called an ASCVD risk score. Okay, so that
sounds
stands
scary.
for atherosclerotic cardiovascular disease score.
I was right. It is scary.
It is. It can be, or maybe not.
Do we also call this the death predictor?
It can't. It predicts.
I would like to call it
a cardiovascular event.
The death predictor.
Now, it doesn't predict death. It's cardiovascular event, heart attack, stroke. Now, that can result, unfortunately,
Oh, that's
in death.
okay.
but
Well, that can be scary too.
yes. So, do you want to find out where you're at with that?
And so, what does this mean again? If we do this, it tells me what?
It gives you your risk of having a cardiovascular event, heart attack, stroke, in the next 10 years and then in your lifetime.
Okay. So it's not like if I have a high score today, I got to stop by the emergency room on the way home and wait for the heart attack to happen.
But this is something that folks can do at home. So with the availability of health information, if you have one of those nice portals through your physician's office, you probably have access to your cholesterol.
All right.
You can get your blood pressure taken at a pharmacy or anywhere else or at home, and you can use this little calculator
All
yourself.
right. tell me
we could probably post a link on our website to it.
Yeah, to one of the calculators. Yeah.
All right, so Andrew has the calculator. So what information do you need?
This is one of those episodes where I need a real answer from Mike. What's your age?
Well, we're gonna do that. You're just gonna have to
I think it's 55. Let's call it 55.
put a 1 in front of that. There's no ways. There's no
Total
way.
cholesterol. What value are we going to work with today?
1 second. This is why I write things down. 189.
HDL cholesterol.
46.
And systolic blood pressure.
It was 132.
Okay. And then personal history, Mike. We can cut this if we need to. Diabetic?
No.
Smoker?
No.
Treatment for hypertension?
Yes.
One question's missing. I'll guess.
We give him one job.
Your calculated risk, 10-year ASCVD risk, 6.9% calculated risk, 3.6% risk with optimal risk factors.
So what that
That's the
means is
10-year.
if he did everything in his control, so there's some things we can't control. We
Okay.
can't change it, our race. We can't change our
Parents.
gender. We can't change our genetics. He could get that from, what was it again?
6.9% to 3.6%.
Well, first of all, is 6.9% good or bad? I mean, honestly, that sounds pretty low to me. I like those odds.
Yeah. I mean, it's conversation with
Are
your
you
physician.
just telling me that because are you thinking to yourself, God, he's already got 1.5 feet in the grave? I mean,
it's always a conversation with your clinician about where your risk score is.
I want to have a conversation with you right now. Should I be worried? I mean, you won't tell me. It's 6 point whatever
No,
percent.
that's good. So less
It is
than
good.
10% is good. Yeah.
All right, less than 10%.
Yeah, that's
You
good.
wouldn't lie to me, right?
No, not at all. Not at all. But
He's lying to me. I'm dead. I'm dead.
But I look at this as also a little bit of a wake-up call sometimes. So it depends on where you're at, whether you're being treated for hypercholesterolemia or not. But for me, like I did mine earlier, and I was actually right about the same. I think mine was like 6.1 or something percent.
So,
but
but
it
it's
was
your
a wake-up call.
But you're younger
I
than
am
me,
younger.
and so if that's 10-year risk, that
Yes.
seems even be worse for you because it seems like as life goes on, your risk is
Right.
gonna.
And even at 5%, that's 1 in 20. So if you're at your birthday party with 20 of your best friends, it's a sobering statistic.
I don't have 20 friends.
Well, that's true. And then lifetime risk is also calculated
Yeah, 50% and 5%
with optimal.
With optimal.
Yeah,
So 50% chance of having a cardiovascular
event.
if I just keep up what I'm doing now, and I can bring that down to 5.
Yeah. Isn't that pretty crazy?
Crap, I gotta exercise or
You might
something
need
now.
to stop eating donuts.
No, their donuts are not linked with anything. Just stop that. That's why people
Stop
like.
eating bacon or eggs. Have you ever seen the time traveling dietitian?
Well,
Funniest video on
no.
Funny or
What is
Die.
it? Tell us.
It's basically that. Well, it's from all the changing medical information we received over the years as consumers, right? So he first shows up and he goes back in time. He's like, "Oh, you can't eat eggs," and then he comes back. He's like, "Oh, wait, you can't eat eggs." And then he comes back. He's like, "No, you can't eat red meat." And then he's like, "Oh, wait, you can't eat red meat." And then he goes back into the Paleolithic time, and he's like, they were not doing good. You know
Well,
what? Just eat whatever you
They
want.
all got eaten by dinosaurs. I mean, when your life expectancy period is 10 years, I'm taking the George Burns philosophy. I'm going to have a drink a day. I don't smoke, but maybe I should start a cigar. And that dude lived just about forever.
George Burns and I actually share a birthday, and he lived to be like over 100.
Yeah.
Yeah, amazing.
Medical science has no idea what they're doing.
Well, and I think a lot of it was our understanding of genetics. So originally we thought, okay, cholesterol, it comes from eating eggs. It comes from eating meat. If you don't eat that, you're going to have low cholesterol. And then we found out, well, some of these people actually are doing the right thing, and they still have high cholesterol. So we found out, well, you know what? Maybe it isn't all diet.
And
maybe
food
it's
is kind of a mixed bag. I mean, there's all the nutrition in there, but then, again, there's all the other stuff.
Sure.
Because they just had that thing in Michigan where fish from the fresh water have high concentrations of the PFASs,
Right.
which is our chemicals. But if you think just eating natural food and stuff like that. But there's other things in there that maybe we don't really account. But, with this, we know that we can increase our HDL, by doing exercise and stuff like this. So I really probably should take better care of myself.
Well, and there's a few things you can do kind of right away. Healthy eating's one. Weight management, so trying to lower your weight.
And I've started to do that.
Physical activity, again, just anything you can do. We say 30 minutes on
So
most
is that
days
why,
of
like
the
on
week.
the insurance company and stuff like that, on these health challenges, a lot of it has to do with steps and getting up and just trying to get whatever exercise you can?
Just a little bit of exercise, every other day would be amazing. Managing stress, I know that's a hard one, but stress actually plays, and you can be measured by your cholesterol level.
See, now that would be an interesting topic. What all stress does to your body. I mean, we talked about it with President Pink, about stress and mental health and stuff like that. I think getting into all of the adverse health consequences of stress and anxiety would be interesting.
Yeah, I think so too. We could definitely do an episode about
Let's
that.
make Ben do that.
We should.
Yeah.
He would do that.
Well, and he's not here to say no.
It's very sciencey.
Yeah.
He could figure all that out.
Yeah, that'd be good for him.
I will say we're getting a little bit low on time. Quitting smoking, of course, is good for a whole bunch of things. If diet and exercise doesn't work, I always want to try diet and exercise first. If that doesn't work, we move on to medications. There's a whole bunch of medications that we can use, but statins, you've already mentioned it, like Lipitor, Pravachol, Crestor. Those medications are our go-to. They're the most common. They're
the most effective ones too, right? For lowering your.
There's some newer ones that you can receive as IV therapy once every just 3 months. You have to get some testing to make sure you're a candidate for those. If you are, they do a really good job as well. But there's a lot of options out there to help bring down your cholesterol level.
And now some of the different medications, they raise and lower different components of that cholesterol. So that's important as well. So even though your total cholesterol might be high, some are better at lowering triglycerides than others.
Some are better at increasing HDL. Some are better at lowering LDL.
And so that's why it's not a one-size-fits-all.
Right. There's even one available over the counter. So niacin you can buy over the counter, and that can help with cholesterol. Although I will be very cautious because too much niacin can actually be very harmful, and it can cause a flushing reaction where you become
low blood pressure and itching. And
so I don't say that you shouldn't do that, but ask a pharmacist about that if you're concerned about, or if you're interested in starting niacin over the counter for blood pressure. Or, for cholesterol. Well, I'm afraid that our time here in Canadian Lakes is drawing to a close.
Can we go stop and get a bacon, egg, and cheese biscuit?
Let's do it. This is so much better, though, than being in the studio. We actually have a window. It's great. Andrew's rolling his eyes because he has to set all this stuff up on location. But, I think it's time to sign off for the day.
Let's get the food truck packed up and get out of here.
Let's do it.
All right.
Thanks for stopping by the Health Deli to sample some of our wares. We're open 24/7 on Facebook and Twitter at The Health Deli, or visit thehealthdeli.com to send us a question or find any of our locations. Please come again. We will be regularly stocking the shelves with fresh content and new wellness specials. As always, we want to give a special thank you to Andrew Tingley and the crew at Ferris State University's Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free.